Get started here. So welcome everyone. This is Keith Summers, co-founder at Health Quorum, and we're very excited to be covering a number of topics relevant to the central theme of understanding how latent demand for healthcare will shape COVID-19 recovery efforts. For those who attended our last presentation in March, you may remember that we briefly touched on the idea of finding opportunity for improvement in an otherwise pretty difficult situation. Today, we'll take a deeper look and a dive into examining responses and consequences of the pandemic, leading to an understanding of what the recovery picture is beginning to look like and how you can prepare for the challenges that lie ahead. We would also love to hear from you during the Q&A portion of today's session, which will take place directly after the panel roundtable discussion. So to participate, please navigate to the gray Questions tab in the webinar pane and click the arrow to expand. You can then enter a question and click send at any time. I'll be monitoring the feed throughout the presentation and will queue them up for the speakers. Please feel free to address one speaker in particular or leave it open to the group, and they'll be happy to take a shot at the questions that you're putting out there. Again, thank you for joining our session today, and let's get started. So before passing the torch to our moderator, I wanted to give a quick refresher on who we are at Health Quorum and how our offerings tie into the topic at hand. As a company, we were founded with a mission to help reduce unnecessary healthcare spending and have been dedicated to helping our client organizations save money and improve risk management by leveraging our AI-powered health claims analytics. For Health Quorum, clinical necessity is of the utmost importance. There can be great procedural outcome that is relatively low cost, even leaves a patient satisfied. But was it necessary? That's the billion-dollar question that we all need to be asking. Now, more than ever, there's an urgent need to employ advanced claims analytics as we begin to enter the COVID-19 recovery period. There are many unknowns, but one thing is certain, that we are in a brand new territory as a healthcare system. Having the right tools to monitor and analyze your data is crucial to navigating this uncertainty and iterating your operations for success. So with that said, we're offering a complimentary sample analysis so you can see the results for yourself. Just indicate your interest on the post-webinar survey, and I'll follow up to discuss details. Lastly, if time allows, I'll be walking through a sample use case after Q&A, so please stick around until the end if you can. All right, that's enough for me now. Let's give a warm introduction to our moderator, Tracy Dodenhoff. Tracy, thank you for joining us today.
Sure, hello, and thank you everybody for joining this afternoon. It's really wonderful to be here and to be talking about this really relevant topic. So I think it's going to be an interesting session. Before we dive in, I just wanted to introduce myself and then introduce our speakers as well. I will just be moderating. My background encompasses technology entrepreneurship, innovation leadership, and also venture investing. My main focus, however, is focusing on first revenue and value creation across stakeholders, whether it's with ventures or new initiatives within larger corporates. I've launched and invested in over 24 startups, and I typically partner with ventures to help them accelerate the growth of new product initiatives. I'm currently launching a product called Max Retract. It's a nurse-designed, clinically validated product for safely positioning obese and morbidly obese patients during surgeries and critical procedures. In addition, I actually am a volunteer for one of the largest medtech membership communities in the US. You've probably heard of it, MassMedic. I'm on their steering committee for their Ignite program, which is designed to accelerate the growth of game-changing medtech ventures. So it's pretty cool. I'm also on the board of directors of Jamse Gotzel, and it's a mission-driven organization that focuses on helping the neediest children in a remote village of the Tawang district in India, and they hope to be a model for the region eventually. With that said, I'd love to introduce my colleagues, Kathy Eddy and Yuen Amiji. Kathy is the founder of Health Plan Alliance, an organization that was started by and for provider-sponsored health plans to help its members be more competitive in their individual markets by sharing a broad knowledge base, identifying performance improvement methods, collective purchasing, as well as insights. With 50-member health plans today located throughout the country, Kathy developed the concept and ran the Alliance since its inception, retiring as president just recently in April 2018. Throughout her career, Kathy has been a speaker and a facilitator for numerous boards, addressing the challenges of healthcare reform, provider ownership, managed care trends, governance, accountable care, and future direction. I'm also going to introduce another colleague, UN Amiji, who will be speaking today as well. UN is a healthcare technology veteran, and in addition to being an entrepreneur, he's held senior managerial positions at well-known companies such as Bayer, United Health Group, Eliza, and Wellframe. He's also founded and advised He's also advised various startups throughout his career, focusing on healthcare data analytics and innovation. UN brings clinical healthcare expertise in launching new technologies related to mobile and digital health, multimodal engagements, predictive modeling, decision support, and artificial intelligence. And I would like to add, all three of us are actually on the advisory board of Health Quorum. So we're all very happy to be here today and to support this very interesting topic that is relevant to all of us. So without any further ado, Kathy, perhaps you'd like to start your sharing with the community. Kathy, I believe you're still on mute.
Okay, thank you. Okay, I guess I'm on. So what I want to talk about is the responses that were, the response that has been taken over the last 3 months of being into COVID-19, and then what are some of the consequences? Some of them we could have told, and some of them are sort of unexpected, but kind of how did we get to the point that we're at today? And then I'll turn it over to UN, and he'll talk about sort of where we're going next. So, you know, a lot of the response had been the suspension of non-essential elective procedures. We've heard a lot about that. And on the next slide, you'll see that there were a lot of recommendations that had been made by numerous different departments at the federal level as well as state level. And those have been coming out since mid-March. A lot of that was driven by this was a new virus. We didn't know how it was going to spread or how what the prevalence was, what the mortality rate was going to be. And there was a concern about the hospital capacity for these patients and the ability for the country to bend the curve. And what we've seen now over those last 3 months is different parts of the country were hit at various different levels. Although the response to it was to pretty much put a lot of things on hold across the whole country. And then another big concern that affected a lot of different areas was just that preservation of personal protective equipment. So this had a lot of consequences for organizations. One of the big ones, and I think this is probably a positive thing to come out of this, is we've had telehealth for quite a long time, but the services were ramped up tremendously when people couldn't go into any type of ambulatory or physician office setting. And so teleservices really increased exponentially, on average probably over 200%, but just a couple of examples of Cleveland Clinic said they went from 3,000 virtual visits a month to 60,000 in the month of March. Mayo went from about 400 a week to 35,000 a week. So for those that have those type of services, there was that challenge of ramping that up and growing. And for others, it was trying to put that into place when they may not have had that before. There was also a lot of concern about just people delaying care. So we've been tracking the number of deaths, the number of cases in COVID, but what hasn't been really identified is just how much negative effect it's had because of care being delayed. You have people who are in chronic conditions, the elderly and those with other comorbidities like diabetes, high blood pressure, obesity, and those are the ones that are most at risk for acquiring the virus and having complications. And those are people who are concerned about going into a doctor's office or seeking care in an ER. And so also for those that have had home health care, even that's been somewhat limited for a lot of different reasons. There's a lot more attention that's now being paid to social determinants of health and how that has in particular minorities have been socially disadvantaged and are more susceptible to the infection. Stay-at-home orders have kept people at home. There's concern about seeking out care. And from some of the studies that have been done, probably half the people at least have skipped care. 11% are saying that they're getting worse as a result of that. And there's probably about 40% of the population that said that they'd postpone care up to 6 months. So that gets into sort of the topic of today about how does that ramp back up? How does that come back? And then even in the cancer area, new diagnoses are way down. Skin cancers by about 80%, and all other cancer patients between 30 and 50%. The screenings that are normally done for cervical and colon and breast cancer, those are down in the 80 to 90% range. And even for children that aren't much affected by this particular virus, the vaccination rates are under 50%, and usually those are running about 2/3, especially for small children. So that whole concern about what are we putting off and what effect is that having? And then there's also the mental health. That's increased tremendously. And where before were anxiety and other types of areas, drug abuse, suicide, domestic violence, child abuse, all of those are increasing as a result of people who stay at home. And it used to be that the under 17 had a higher anxiety level, and now that's sort of shifting to the 18 to 34-year-olds, which makes sense given that a lot of them are maybe in that 40 million that have lost their jobs in the last couple of months and are unemployed, and just looking at the financial stress that goes along with that. So, and then there are special groups that may not be needing the care and attention that they need. Children and adults that have developmental and intellectual disabilities, people that are at home and can't get out for care or maybe to get home care. So there's a lot of different people that are being affected within this area. The other consequences are really affecting the provider's business model. And here we've seen this where, originally we put a stop to so many different things within healthcare to preserve the capacity, but in the unintended consequences is we've really harmed the business model in many ways, financially and also in other areas. So we have about 5,200 hospitals around the country that now have idle clinics and vacated operating rooms. They've got a dearth of patients. The hospitals are projecting that they're losing about $50 billion a month during the shutdown, and that'll reach about $200 billion by the end of June. An example of one 562-bed hospital in the state of Oregon is they only had 50 COVID cases, but their occupancy fell by 60%. So even hospitals that had capacity just weren't using it for other purposes. And you're now seeing that ramp back up between now and the next couple of months of bringing that in place. There's also been a huge impact on lost jobs. And in other economic downturns, healthcare sort of has been able to weather that through pretty well. But in this one, there were 43,000 layoffs or furloughs in the month of March, but that jumped up to 1.4 million in April. And of those that have been lost their jobs or furloughed, 4 out of 5 of those are in the ambulatory settings. They're dentists, they're doctors, chiropractors, outpatient offices. And now you're starting to see news stories about significant layoffs happening in large healthcare systems as well. The elective procedures, and those have been down both in and outpatient facilities. The ones that have been hit probably the hardest in the inpatient have been spine and joint replacement surgeries and cardiology. In the outpatient, it's been ophthalmology and dermatology that have probably been hit the hardest. For medical groups, they're also seeing a big decrease in revenue, about 55%, and probably a 60% decrease in patient volume. So even though there is, the telehealth alternative, they're still seeing a big hit to both revenue and patient volume. And that's resulting in the furloughs of workers. And then they'll also, when you think about them coming back up, they're going to have limited resources to do that in the future. As I mentioned before, telehealth seems to be on the upswing, but it works better in primary care. It's not as helpful in some of the specialty care areas, and that'll probably remain in the future. We probably will swing back some to in-person offices, but a lot of people that have used telehealth are very satisfied with it. So that ability to merge that into the model will be very important. And then the consequences have also had an impact on the coverage, the cost of it, on insurers, on employers, and then also on individuals themselves that are paying their own insurance coverage. So for the most part, insurers have said they will pick up the cost of COVID-19. So far, that's been testing. It's been care if they've been hospitalized or they're seeing care as a result of that. The vaccine, should that come out later this year or next year, that's probably also something that would expect it to be covered by insurers. The insurance industry is interesting because they have weathered this pretty well from a financial standpoint, where they've kept their coverage, they're being paid, and they have less going out for claims because people aren't seeking care, and that's been less than the COVID cost. But at the same time, they're trying to help out their customers. And a lot of times with employers, they're offering them some premium waivers, some reductions. It's been pretty flat or low increases for 2021. And they're also looking at expansion. So people that are losing their jobs may be able to go onto COBRA, but that tends to be fairly expensive. So you're seeing a lot of a shift to the individual market under ACA in the exchanges where people may get some sort of subsidy. There's also a bigger demand for this under Medicaid, but that's also going to put a strain on state budgets. So some states have expanded their Medicaid and others have not, but that's an area of the safety net, whether that's the individual market or Medicaid, are going to be ones that you're going to see a lot more demand for if people feel they can afford it. And some people have said that they've foregone medication or they've foregone seeing a doctor just because they feel they can't be there. So after 3 months, that we've had a major shift in both how this has affected the providers of care, how it's affected the patients and the members that are receiving that care, as well as those that are out there paying for it at all different levels, whether that's the federal government, the state government, or employers, or out of your own pocket. So quite a big shock to the system. So now I'm going to turn it over to UN and let him talk about sort of what comes next.
Actually, before we turn it over to UN, Kathy, wanted to ask you a quick question. Sure. As you mentioned, we've seen that patients are, in many cases, benefiting from the drop-off in care utilization, but do they need to be concerned about the longer-term effects triggered by patients not seeking treatment for chronic conditions and preventative care? I just wonder, are we waiting for the other shoe to drop? It seems maybe restarting high-priority services as soon as possible.
I think a lot of payers, especially in the Medicare market, for Medicare Advantage, they have been trying to look at their populations and where they should be getting care and how to prioritize that and how to push that information out to the providers. So what they've put into place for risk adjustment and for star ratings and other types of things, I think is going to be very relevant going forward to make sure that the people that need high priority care and services, and maybe put that off, to get them in and get them scheduled and get that done. Where before we were trying to look at where there were gaps in care and filling that in, now it may be more of a prioritization process of getting the right types of things done, especially for patients that are at risk. And how do you identify them and how do you help them or facilitate getting the right kind of care as the care capacity opens back up?
That makes sense. And actually, UN, I'm going to ask you, just before you start sharing your thoughts, to maybe address that question as well. What are your thoughts on that?
I echo what Kathy said as well, and just adding the fact that it's important to focus on limiting through optional point of view on the low value of care services, especially during these critical times.
Makes sense. Well, perhaps you'd like to start sharing on your portion of the presentation.
Thank you. Hello, everyone. Thank you for being on this webinar with us. So as Kathy accurately defined, COVID-19 creates an unprecedented demand on our healthcare system, which in a matter of days caused total rethinking and prioritization of the healthcare delivery. Key effects include the pause of elective care by as much as 80 to 90%. And of course, one that's the most publicized is the virtual acceleration rate of using technology like telehealth, which Kathy mentioned. Some would even say that in less than 60 days, we fast forwarded the progression rate of technology adaptation by virtually a decade. Many healthcare systems have seen prioritizing and they have already started prioritizing the patient care throughout the pandemic. Others are just starting to figure out their strategies. And in some cases, this may simply be their demise as well. And logical solution may be that they need to close the business, unfortunately. Over the next few minutes, I will be speaking about the latent demands of the care. What does that mean? And the sudden increase in utilizations, as well as the challenges that we have in patient prioritization, and how do we get the high priority care back on track. Accessible healthcare is just as essential now as it ever was. Not only are there COVID-19 concerns, but the social isolation for many and lack of access to routine healthcare can create genuinely unprecedented challenges for all of us. For example, my mom has various health-related issues. She has AFib, is obese, has mild COPD, her knees, shoulders, and back are shot with arthritis, and she's close to being immobile. So she gets other cortisone shots regularly. She's also on 9 different medications, and under normal circumstances, she saw her physician frequently. Actually, physicians in many cases. To top that, her helper is herself on a self-quarantine because of being exposed to the virus. She's left alone with me as the only person who visits her periodically. She worries about whether or not she would get the medical help she needs, and go to the doctor and hospitals. It would be the right choice right now during this pandemic. At the same time, she is worried about her aching conditions, and because she loves life and her family, she knows that she needs to keep track of her health care and stay on top of that. My biggest concern for her right now is about her mental health and the toll that she's surely taking, and is creating the anxiety and the depression that she has. And this is very important point, because the mental health will be a major issue for many people, even well beyond when we are in control of the COVID-19 and the pandemic that we have today. And that's one of the things that we see. Many people have to deal with all the death, the grief of the death, or they may have to deal with the depression or anxieties that is caused by it. Just to give you an example, before COVID-19, 11% of adults actually experience a panic attack during the year. You can imagine how much that has gone up further. And PTSD is not just associated or is limited to those who have served this country, which we thank them for. And shout out to all of them and all of the first liners that are doing their job today. But it's not only for them, but also the others who are under stress and under pressure and under circumstances that our first line care team is under today. There are a few quality metrics for hospitals and patient surgery centers based on various recommendations that CMS and other healthcare authorities are considering. Being able to keep track of transparency to let the patients know of their providers and facilities that they are adhering with these metrics is very important and will go far in winning a patient's back. Many people don't know how the environment is, and what acts each organization is taking to take care and manage their facilities. But that is important, because the communicating that is very important. Just today, I read about the Mass General that they are seeing, even though that here in Massachusetts, we are one of the hardest hit states, they are seeing very good results in respect to making sure that the virus is not spread by their people and within their environment through a number of things that they have done. For example, from the hygiene measures, screenings, distancing, and wearing masks and gears. So those things have really led to being able to make sure that the virus does not get distributed. And that's so very important that people also follow that, and that we follow that. Those providers who are moving towards reopening and increasing volume must ensure that their staff can provide a high level of care needed in the safest way possible. Many are starting with patients that have time-sensitive health care needs. For most part, best practices are being implemented to keep the community and the staff safe, using guidelines set by the Center of Disease Control and Prevention, CDC. One of the things that I'd like to focus on is that the fact that we need to focus on what can work with, what we can work with. Shifting your focus from what you're missing to what you can work with, what resources are available to you will make a big difference in that respect. And believe me, progress may be slow, but it will pay dividend. Just because it's available doesn't mean it's beneficial also. This is where Health Quorum has built their foundation around, in fact. Low value care detection and providing tools to compare provider performance is very important, and now more than ever, it's important to be able to look at that. And in fact, it has created an opportunity for us to be able to almost reset the time and to reset the expectations to go back and to look at it. But to do that, really, there's an important need and a need to understand where we have been and being able to measure it against something. Otherwise, we are flying basically blind in that respect. Here, the challenges with patient prioritizations. The shift in population and reimbursement rates can be a factor in patient prioritizations. I've spoken to a number of people recently that they were trying to figure out different ways. Many of the organizations are there to make money and to produce income. And that has become to be one of the questionable things of how you get to it and what's the best way to go at it. Given the unemployment rate that we are facing right now, which back in April was nearly 15%, and it is continuously going up, the Medicaid enrollment is on the rise. Changes in demography and mix of patients for many providers is a part of what is this change will bring as well. Massive budgets are not there anymore, and the traditional ways is not working because traditional providers are losing revenue and patients. These economic hits are amplifying a greater need for additional support by qualified care providers, as well as utilizing solutions that can help to maximize a higher priorities and deliver their higher high value versus a low value. Quality and training of clinicians is also essential. This is quality and training on the new technology. There are new ways and new technologies. We have very qualified clinicians. The new capabilities is important for them to really have a best understanding and best way to be able to take that and to move forward. And making sure that providers are not going back to the past routines and where inadequate and low value care to patients were being done, to be able to limit that and to stop that. This is the best time to do that. These low value cares and band-aids, like for example, costly pharmatherapies. If someone, for example, has a behavioral health issues that may be introduced to a psychologist, and psychologists in many cases will write a prescription. for them for medication prescription, which in many cases the prescription does fairly okay job, but they are not long lasting, or in some cases don't really take that much of an effect. And people have many different ways for not taking medications, so that becomes to be an issue. But that limits the success rate, and because of that, the only way that we can get ahead of the curve is to keep a close eye on analytics by comparing normal practice patterns and to post-pandemic patterns of care. For example, Health Quorum users are running Health Quorum Live on their network in near real time to produce data for a proper model that identifies low-value care and trends. This capability can help organizations streamline their revenue process and enable them to quickly adjust care delivery as needed. Some of the other things that are important to look at is the processes that everyone has to go through, and how can we improve some of them, including the accelerating process of that, accelerating the process by itself, and that people getting frustrated about. For example, if we can streamline pre-authorization, that will go far in helping the healthcare industry and healthcare organizations to be able to manage people with the and prioritize patients better. Some healthcare systems that were in the process of introducing technology advances like telehealth, so their e-visits and their online use go from 10 a day to 4,000 a day. This is something that is, as Kathy mentioned as well earlier, it's happened overnight virtually. Many of them, I myself was caught in that. As I mentioned, I'm a caregiver for my mom, so we were supposed to take my mom to a doctor's appointment. The doctor called and canceled the appointment, but they wanted to do a teleconferencing. Being one of the first days of that, you can imagine what we had to go through. 2 or 3 times we had to change the time of that day of when we're going to get together. The doctor needed to figure out how to get online and so on. So it really was an interesting process, but that's something that is now becoming to be a part of the future. Going forward, the new norm really is setting itself, and the digital technology is becoming to be part of that. But it's also, it's important to remember that it's not just remote telehealth, it's other things, the remote monitoring, home healthcare, and the social needs, the social determinants of health is very important. The social needs and the digital therapeutics that is required in that. And to manage those things and to be able to utilize those things right, you need to be able to keep track of them, and you need to be able to understand where is better to utilize them. Basically, putting the right medium with the right, publishing the right medium for the right provider to utilize in the marketplace. And that's something that Health Quorum has created solutions to develop utilization models around it, be able to help you with that going forward. One of the other things that I wanted to speak about is what in the industry, in behavioral health, many people are referring to as the silent pandemic. This is what, as was mentioned earlier, behavioral health and mental health are going to be a very important components of moving forward. Therefore, it's important as an organization to be ready for it. There are great opportunities and great solutions out in the marketplace, and more are coming. But it really becomes to be a fundamental decision of how best to utilize that to manage the care of the population, matching the services to the resources that you have, essentially, because there are so many of the organizations out there that are trying to do everything and offer everything, but not necessarily that's something that's good for your organization to be able to deal with it. But it's important to look at it. I mean, and again, as part of that, it's very important to understand your providers and understand the capabilities that you have and understand how you can approach the marketplace with it. Thank you.
Okay, well, we're just going to recap a little bit and then maybe dig in a little bit deeper with Kathy and UN before we get to Q&A. So essentially, the response that we're seeing, just to recap on this, is a suspension of non-essential elective procedures. And this is, ultimately there's issues with problems with chronic conditions, preventative care, appropriate utilization levels. So the consequences of this can be pretty profound. So there's impact on providers and their business model, and an impact on payers, employers, insurance coverage. I mean, there's just an awful lot behind this when you start to unpack it. So when we start to think about the recovery process, we're going to see a latent demand for care that all of a sudden starts to emerge. Getting high priority care back on track is definitely going to be something that we want to pay attention to. And this is going to lead to a challenge with how do we prioritize patients with this big backlog, and how do we cope with this sudden increase in utilization. So this really brings us to the overarching question, and that is, what can we do to prepare for and manage these challenges? So I think what we'll do now is transition over to chatting a little bit more with Kathy and UN, and maybe I could share a specific question about what your thoughts are. What can self-funded employers do to prepare? And maybe Kathy, would you like to start?
Sure. I think one of the things is working with the population that they have and finding out what are some of the key concerns of going forward. UN had mentioned about the mental health and that being a larger component of it. Are there additional services that can be ramped up and promoted there? Letting employers know what they can do to help their employees in receiving services and what's available. A lot of employers have gone to work from home, and so their ability to reach out to their employees and encourage them to get the right type of care, what's needed. I think because self-funded employers, pay what their specific claims are, I think that the silent pandemic, the unresolved services, what people aren't getting, they could see a shift in later. So really trying to get employees to pay attention to what they need to do for their health going forward, I think would be important.
Mm-hmm. And UN, what are your thoughts on that? What self-funded employers might want to do to prepare?
I think one of the key point is to being able to begin implementing strategies to incentivize members, as Kathy, very similar to what Kathy is talking about. But incentivizing them to do things is very important. We have seen that work in past, and process that will do the same. And tracking the claims and the risk management techniques is very important, because that is something that right now it's very important for them to be able to, and they cannot afford to not pay attention to it, essentially, in that respect.
Mm-hmm. Makes sense. So UN, let's start with you on this question. What are your thoughts on advanced claims analytics? Will implementing advanced claims analytics put you in a better position to drive value, do you think?
Yeah, with healthcare spending as it is, there's enough dollars to go around. The challenge is putting the spend to the best possible use. You first need to measure and analyze what's needed, what's going on, and how spending trend is over time. And as I mentioned, if not, otherwise you're flying blind, essentially.
Mm-hmm. Yeah, that makes sense. Kathy, do you have any comments on that?
Yeah, I think, as I mentioned before, especially for payers, to look at who are your most at-risk populations, and based off of past claims data, where should you be seeing future claims or alerts to get care and drive that up. Another is some people have said that they're just putting off for financial reasons having the prescriptions filled or getting care that's needed. So being able to monitor that and sort of send up red flags earlier on those populations, and how can you sort of monitor that more closely with some of the analytics ability. And then I would say probably the other thing is to say, well, what are the high value services that we really need to drive, and what are the ones that maybe are taking up are being scheduled but aren't as much value in going forward. And are you seeing any type of thing from providers where they're not hitting on the right type of services that you'd want to see? And is there a way to partner payers and providers to really hit on those high value services?
So it sounds like a lot of insights and focus on choices and behaviors that can ultimately have a big impact.
Yeah, probably much more outreach to the patients and the members than they've done in the past.
Yeah, that makes sense. So, Kathy, is this an opportunity, do you think, for us to recalibrate how we define high value care? And how do you think that might impact payers?
I think so, because they've had some discussions about people just not seeking even emergency type of care because they're concerned about going to a hospital ER or going to a doctor's office. And often the populations that they're saying that are most at risk are the ones that you want to pay the most attention to. So I think really rethinking about those that have chronic conditions, those at-risk populations, and maybe some redesign about what's the best way to reach them for the care that they need. I think telehealth is certainly a piece of it, but there's a lot more to virtual care that can be incorporated into the provider's workflow, into the payer's thought process, how they reimburse that, how they encourage that. So the redesign of how care gets delivered and how it gets paid for, I think there's a good opportunity to use this sort of pause in many things to say what's a better way to bring that up, and who are the at-risk populations that we want to reach, and what services do we want to reach them with.
Sure, and Yuen, that is so aligned with your case example of your mother. Maybe you'd like to make a couple of comments on that as well.
Yeah, absolutely. And I think that's what Kathy said is absolutely correct. And it's very important for payers as well as the providers to really rethink and make sure that they are properly tooled and be able to measure that properly. But this is, if there's a silver lining, in this case with the pandemic, which really is very tough to think about, the silver lining here is that it has given us a once-in-a-lifetime opportunity to reevaluate and basically reset our strategies. Things are happening very quickly, so the question becomes to be, how do we find out and reaffirm the best practices and give evidence support in what is working and what is not, to be able to set ourselves up for going forward. As I mentioned earlier, the new norm is not the same, it should not be, and it's in many cases will not be the same as the old norm. So it's important to really look at that and take advantage of that opportunity to recalibrate.
So definitely some opportunities in all of these challenges to bring healthcare to another level. With that, I'm going to hand it over to Keith. I know, Keith, I think you were going to accept some questions from the audience.
Absolutely. Thanks, everyone. That was really great. We have a handful of questions here, so I'll start from first in, first out, and they're not addressed to any particular person. So whoever wants to hop in, Kathy, Yuen, Tracy, by all means. So the first one we have is asking, how has the pandemic affected our path to value-based care? Is this a step backwards, in your opinion, or is it moving us forwards?
Let me try on that one first. I think it can actually be a step forward. I know we've been trying to accelerate that, and actually the providers that have been in value-based care are probably weathering this a little bit easier because they had a steady revenue stream. They're used to doing population health, looking across and really trying to provide services in sort of different ways. So it can be, I think, for those that have been in it already, a way to accelerate that and rethink the model. I think those that can't get out of the fee-for-service mode may have a harder time with making that shift, but it can be an opportunity to move into that or do it more broadly.
That's absolutely correct. I was dying to answer this question when it came out. Whomever sent it, thank you for that. It's a good question. Actually, yeah, a couple of days ago, I was on the call with the executives at a very large healthcare provider that deals with those challenged and underserved, essentially, markets specifically. And their model up to now has been very much a model of fee-for-services type of approach to it. And we started talking about the different codes and different different ways for them to revenue recognize in what they were looking to do for behavioral healthcare solution that we were talking about that. But I agree with Kathy, and for those who are in the value-based care, this is actually a boost, and it works. Those who are not, this is an opportunity because it does lend itself well to value-based type care and being able to bring that to the table.
Yeah, and I'm just going to chime in for one quick second and say that I also think the dynamics that have taken place over the past 3 months with the use of technology have also accelerated an openness and willingness to incorporate new forms of technology to deliver care that may actually help extend reach while managing costs. So I do think I agree with Kathy and UN sort of holistically that there are a lot of opportunities that have come out of this challenge.
Great. And I think we actually got another question just now that ties in really nicely with what you just spoke on, which is, are you able to share what you might consider high value services or high priority services?
You know, I would say that those that you would say are things that people immediately need. You know, if they've put off, you know, having certain types of, say, joint replacement or cardiac care, things that, you know, somebody's health is going to get worse if they don't have those types of services delivered. And that's one of the things that I think, you know, actually Health Quorum's been good about identifying of who does a better job at providing those high value services and those that don't have as much of a priority or deliver as much value. I think those that are evidence-based to go forward, also looking at, you know, what drives, you know, a lot of the preventive measures and things have been put into place for cancer screening, for other types of things, I think are really important. And that's why they're part of the HEDIS measures and the star ratings. That those are the types of services you want to make sure people get on a routine basis.
Very good point. I agree with Kathy. And what came to my mind was a stat that I read recently that a provider organization put out this article about the person who needed to get a service issue taken care of with her heart and needed a stent in there. So that's considered a high priority. But in many cases, you know, you have to look at it. For example, knee surgeries and things like that. It may be that it's important and it may consider high priority, but is it the right thing or not? Is it actually the person needed it or not? Just because the person has a pain in their knee doesn't mean that they need to get knee replacement. So and echoing what Kathy said, Health Quorum's solution is really great to be able to identify those providers that are essentially delivering what we consider the low value care by doing things that it may be part of routine things to do, but not necessarily is valuable for the patient itself and is necessary for the patient itself.
Yeah, and I'm just going to add, I think that, you know, ultimately the objective here is impact and focusing resources on where you're going to have the biggest impact. And so, you know, that's, again, one of the reasons why I think the Health Quorum solutions are so powerful, because you're able to really be focused on how to get the most impact, how to target those resources well. And, you know, the data available and the ability to have access to analytics that are focused on your objectives, focused on your ecosystem, I think are, probably critical as we enter into this next phase, because, we are going to face some challenges. And I think, for the foreseeable future, understanding the most effective way to target those resources is going to determine, how we thrive in the long run.
Very good point.
Makes perfect sense. So with that, I think we'll wrap up Q&A. As I mentioned earlier, I have some information queued up here for those who are interested in sticking around. Take a look at Health Quorum's 2 primary solutions and a use case in this particular context. And we'll show you quickly how the application works. So warm round of applause for our panel. They were incredible today. Tracy, thank you for moderating. Kathy and Yuen, great job. And I'll move now to some of the Health Quorum information for those who'd like to stick around. So as I alluded to during the introduction, Health Quorum solution can help address many of the challenges that our speakers just discussed. Your actual strategies might vary based on organizational needs. So for example, health plans might want to focus on working with their network of providers to prioritize certain types of care, while employers may be primarily looking to limit their financial exposure to variation in care due to the pandemic. But whatever the case may be, it can be powered by Health Quorum's solutions and technology. The Health Quorum Now platform is accessed via the web and delivers analytics on provider practice patterns and trends, along with scoring for over 1 million providers nationwide. We can look at pre-pandemic activity and establish a baseline for how individual providers and groups tend to operate under normal circumstances. But we all know, as we just discussed, that things are definitely not normal right now, which enters Health Quorum Live, our standalone client-side application. It goes and analyzes claims data in the near real time and detects instances of low-value care. So we can compare how a provider typically practices with Health Quorum Now to how much low-value care they are doing in the new normal with Health Quorum Live. Not only does this indicate wasteful spending, but it shows that they are being utilized for unnecessary procedures when they really should be focusing on high priority, high value services like what was discussed just now and throughout the session today. So armed with this knowledge, our clients have actionable information to optimize their healthcare spending and that of their members. So here I'm going to walk you through Health Quorum Live application and its output. You'll see that we have sample CSV files for member eligibility, medical claims, and pharmacy claims. And when we click to run the application, it instantly analyzes those files and creates a low-value care report. So you'll see that pop up in a second here. And you'll also notice there's a log file noting the steps taken, which we can open and take a look at. So just confirming what I mentioned here. And then we'll see that the report, of course, can be uploaded to your database to slice and dice however you'd like, or it can be viewed in a dashboard customized for your needs. So we'll show you the Health Quorum Live dashboard, and we'll import the low value report that we just created. And it's a little bit small, but hopefully you can see that we found 133 records out of the sample claims data. And now we'll restrict the date range and whittle it down to 18 records. And we'll take it a step further and only choose records with a confidence level of 3, meaning the highest out of 1 to 3 for us. So we have 4 records here and 4 instances of providers with low value care during the selected time period with this confidence level. And of course, the findings from Health Quorum Live can be segmented and analyzed over time, producing even greater insights. So we could run this from day one, and then we could see at the 1 month mark, 2 month mark, quarterly, annually, how these providers are trending over time. And as we mentioned, it's going to be particularly important as we move through this recovery period and providers perhaps aren't practicing as they normally would. So with that, if anyone has any questions on the solution and technology, happy to answer. Otherwise, I'd welcome you to reach out in the post-webinar survey. Just indicate if you're interested, and we can set up time to walk through things in greater detail, as well as provide that complimentary sample analysis that I mentioned earlier on. So for everyone on the line, I want to thank you very much for your time. I hope the information was valuable and that you found it interesting and relevant. Any feedback's appreciated, and we look forward to seeing you on the next one. Have a great day.